My name is Gail Faulkner and I'm Head of Children's Social Work Service in Leeds for the east of the city. I'm also lead for domestic violence for children's services, and I also manage our front door arrangements, which is where all the calls come in or contacts about anybody in the city who has concern about the welfare of a child. Social care is a really key responsibility in working with victims of domestic abuse. Most of the victims we find are women, although there are some victims who are men. We work with families, and so working quite often with mothers to help them, to help their children and keep them safe is a really crucial part of what we do. We also, of course, work with men. Men who are violent sometimes need some help to think about what they do and to try and change their behaviours. But most of all, we work alongside women and their children to make plans to keep themselves safe. And that might be leaving the family home, it might be working with services to get some support, it might be working with the man for that person to leave the family home. But it's a really crucial part of what we do every day. The law really sets out that social care in children's services are there to protect children from harm. That's our main job. We're very skilled in listening to children, communicating with them, really making sure that when something unhelpful or harmful in families is happening, that we can ensure that the child's voice is heard. We also work in partnership with all the people who will be seeing that child every week. So children's centres, health visitors, schools, and what we're able to do in those circumstances is make plans so that children have got some support. Obviously they're in school every day. If they are experiencing domestic violence at home, they might need someone in school just to be able to talk to. Not that everybody in school needs to know, but obviously we work across all those services in children's services to ensure that children get support. We also make sure that we're thinking about the harm that a child is experiencing. We're assessing that harm. We're working with the family to reduce that harm. And that can sometimes just mean working with grandmas or aunties just to help that child. Make sure they've got somebody to talk to and keep the harm reduced so that they are as well and that their well-being is protected so that they can flourish into adulthood. We know that many people who are experiencing violence in the home, that sometimes the people who are perpetrating that violence on them threaten them that their children will be taken away. We know that it's a real worry, and we're very sensitive to the fact that even a social worker turning up to your door is a worry for everybody. It would be a worry for me. But we are a helping service. We absolutely don't want to separate children and their mothers or their fathers. We work really hard to keep children in their family. The law requires us to do that. Our professional standards require us to do that. It's just sometimes really unfortunate that a small number of cases where we need to remove children because the violence is so extreme and we're not able to reduce that in the family. But sometimes a small number of cases then make lots of people worried. But we absolutely don't ever want to remove children from families. We want to keep them together, but make sure that everybody's getting the services they need to make sure that the children are safe. What I'd say to people who are concerned about domestic abuse is that social work, social care is a service to help them. So whether you're a neighbour or a family member, or it's happening to you, or you're actually hurting somebody, make a referral. Don't think that social care won't be there to help. They absolutely will. There's very skilled people. Please don't just ignore it. Do something about it. This is serious stuff and there are people out there to help.